Active euthanasia. Active euthanasia, the active acceleration of a good death by use of drugs etc., whether by oneself or with the aid of a doctor. The word euthanasia comes from the Greek eu meaning goodly or well and thanatos meaning death. So, euthanasia is literally the good death. In 18th century England, that was what euthanasia meant, a good death, a welcome way to depart quietly and well from life. Today the most commonly understood meaning of euthanasia is more than this old dictionary definition of dying well, a good and easy death. Euthanasia refers, for example, to the situation when a doctor induces the death with a lethal injection, of a patient who is suffering unrelievedly and has persistently requested the doctor to do so. Suicide, whether irrational or rational, for unrelated reasons is not euthanasia. Nor is euthanasia the forced killing of another person. Human euthanasia is legal in the Netherlands, Belgium, Colombia, and Luxembourg, while assisted suicide is legal in Switzerland, Germany, Japan, Canada, and in the US. Euthanasia is the intentional termination of life by somebody other than the person concerned at his or her request. Assisted suicide means intentionally helping a patient to terminate his or her life at his or her request. Euthanasia is the termination of life by a doctor at the express wish of a patient. The request to the doctor must be voluntary, explicit, and carefully considered, and it must have been made repeatedly. Moreover, the patient's suffering must be unbearable and without any prospect of improvement. A C T I V E U T H A N A S I A. Active euthanasia.